Hello there, and welcome to Paul's Garden Gab. It's Friday afternoon, and this is the second of the Garden Gab events that I've been doing. Last week we started off doing our chat with Matt Drennan, one of our local volunteers, who we were talking to about his kind of response to COVID and stuff like that. Today we're back out in the sunshine, which I'm really grateful for because I think, to be honest, the weather forecast had said that it wasn't going to be quite as nice. It's a wee bit windy today in Neilston, so you might hear the wind in the background and the rustling of the trees. But as always, the sun shines, which is great, and we're delighted to be joined today by a different guest. So we've got Gemma with us, and Gemma is a really interesting guest because during COVID, she has been working in a local pharmacy. And as you know, the whole kind of ethos behind these garden gabs is to chat to people about what they've been doing during COVID-19, what their experience has been during lockdown, and kind of what they think can happen in the future so that we can change our community and our society for the better. So welcome, Gemma. How you doing?
Yeah, I'm good. Thank you for having me.
Great. No, not at all. Do you want to tell us just a wee bit about yourself, Gemma, and kind of what have you been... well, first of all, what do you do? Both in terms of your uni life, because I know you're at uni as well, and what do you do in terms of your job?
Yep, so I currently go to Glasgow Uni. I'm just going into third year, and I do immunology and microbiology. And when I'm not at uni, I'm at work, and I work in a local pharmacy as a dispenser.
Okay, so you've been working in a local pharmacy, so I think that's really interesting, and we're going to talk a lot about that in a wee minute, but immunology and microbiology at Glasgow Uni. So obviously you've got an interest in what's going on right now because it's quite relevant to your field of study.
Yeah, definitely. When COVID first kind of came onto the scene and no one realised how big of an issue it was going to be, we did talk about it quite a bit, like in uni. We discussed it, but no one could have prepared for how big the situation was actually going to be.
Absolutely, and I think people had been warning for a long time that there might be a kind of pandemic, but I think it wasn't until it really struck that people realised what was going to happen.
Yeah, I think even the senior lecturers, like I don't think anyone could have really expected this, because certainly like within my lifetime there's never been a situation like this, and I don't really think there has been on such a big scale before in any of our lifetimes. So
yeah, I mean, I don't know if you're the same, but talking to my mum and dad as well, they can't remember a time when, something like this has happened where, everything's shut down, we've had to bring in different measures to look after people. I mean, it really is extraordinary. Yeah. And I suppose for you as a student, that is really interesting. I mean, obviously it's a really difficult time and a tragic time, but I'm sure you're really interested in the science.
It's a horrible situation, but the way that it works as a microbiologist, as an immunologist, is fascinating.
Great. Okay, so there's a couple of people coming in now to watch. So if you're joining us, hello. We're with Gemma on Paul's Garden Gab, and we're talking about her role during COVID-19. So tell us a little bit about what you do in the pharmacy in kind of normal times.
Yep. So normally I just work a Saturday, and during a Saturday it's honestly quite quiet. Just a normal day.
What kind of things do you do? So you're a dispenser in the pharmacy, so I guess that's what we would all recognise as the person who probably deals with you at the counter and takes your prescription and kind of goes off and gets it sorted for you.
Yep, so I'm the person who would take it in, put it through the computer, make it up, leave it to get checked by the pharmacist. I would also deal with any daily patients that we have, get their medicine sorted, and then if I was to work during the week, that would also involve maybe going to the doctor's surgery and picking up any scripts that they've got for us. During this as well, sometimes I can be popping a few of the Dorset boxes for like maybe people with arthritis or people on a lot of medication, or like elderly people who don't have the facilities to take care of their own medication.
So quite a busy role for you then in the pharmacy, and do you enjoy it? Is it something you enjoy doing?
I do, yeah. It can be a bit of a pain sometimes, but I do actually enjoy it.
Is that because, as a student, is it the whole student job thing? Is it like on a Saturday, having to get up, go to work? If you've been out on the Friday night, it's always a bit of a challenge.
Wee bit, yeah.
Well, listen, I mean, I think it's great that you have a job that you can do part-time that's really relevant to what you're studying and you're really interested in, but tell me about, obviously, COVID-19 coming in and you being in the front line, really, in the pharmacy.
Oh, gosh, it just all seemed to happen at once with the pharmacy. So all of a sudden it was people aren't allowed out, so they're quickly phoning their doctors. Oh, can I get this? Can I get this? I need these inhalers. I need these inhalers. And I think it was a wee bit. We saw the stockpiling in the supermarkets, and I think it was a wee bit of that. But the thing to remember is people were just scared. They were just scared that they were going to run out. So although it made pharmacy life a wee bit difficult, a wee bit more hectic than would normally be, people just wanted reassured that in these times where everything was all higgledy-piggledy, that their medicine, something as important as their medicine, would be the same and would just be a constant.
I think that's really insightful, and you're right. I think at the start of lockdown, because people didn't know kind of what lockdown was going to be like and what it would involve, I think you're right, there was a lot of fear, perhaps, of panic. But you guys reacted really well, I think, in terms of just being calm and collected. And I think we've seen that in pharmacies across the community.
Yeah.
So obviously there was going to be some big changes for you as well during lockdown, particularly around the kind of hygiene measures and things like that in the pharmacy. I mean, obviously pharmacies are medical environments, so they are usually very up to speed on all that stuff. But this was like totally different, wasn't it?
Yep, definitely. So our pharmacy was really good that we were getting PPE as soon as was needed. We had like an ample supply. That was really not a concern for us. So our PPE included, we had the masks for over the nose and mouth. We also had the visors. We had aprons, and we've also got gloves as well. And when there was like the big shortage of the antibacterial gel for the public, luckily the pharmacy did still have some, so we were all right. But it definitely did change, because even with things like we would be able to do blood pressure checks or diabetes checks, we're not able to do that at the minute because you'd be into close contact, so it's just not safe for me to perform it or you to receive that.
Absolutely. So if you're just kind of tuning in there on Facebook, it's Paul's Garden Gab on a Friday, and I'm joined by Gemma Howell. Gemma and I are just chatting about her role in one of the local pharmacies and about how she's been kind of dealing with COVID-19 and supporting people in the community. So we were just talking there about PPE and that big change and the change in the kind of services that you're offering. But I guess you guys have been on the front line because supporting people with medication has been so important. What's been the biggest challenge, do you think, in terms of wearing the PPE and stuff like that?
Well, I think maybe last week and the week before, when we had the really warm weather, it was a bit of a struggle. You know, it does restrict your breathing a wee bit. So I think just being a wee bit too warm, naturally you want to just have like a t-shirt and your work trousers, whatever. But like having your apron, having your visor, having your mask, especially gloves, like you can get a wee bit warm, I'd say. But you know that you're doing it for the right reason, so you just need to keep on going.
And how have people reacted to that? Because I think maybe for some people that can be quite intimidating, because you know, if you're used to friendly Gemma, you know, just being there and kind of you know, and you'll have your regulars, I'm sure, who are in all the time. Have they kind of, you've noticed a change in them? Have you had to try and reassure them in a way?
I think so. Like even as someone, I feel like my regulars are okay. Like they know the score with what's going on. But people that aren't normally in pharmacy, normally you'd give them a wee smile, you know. And it's hard to do that for a mask. People don't. So it's kind of hard to reassure people like it's all right. Like we'll get it sorted for you, whatever. But it's kind of hard to show people that like you're fine, and even though you've got that on, like it's okay. Like I'm trying not to be so intimidating.
No,
I've just got my mask on.
Of course. And I think, to be fair, as things have gone along, everyone's kind of learned to accept that in some way. And the queuing as well. I mean, that's been interesting. Have you had to man, or not man? That's the wrong expression. Sorry, staff the queue, I guess. Have you had to maybe reassure people about that? Because I think at the start people were getting a wee bit frustrated by that.
So in my shop for a long time, I think it only stopped this week. It was just 2 people in the store, so one person at the front of the counter and one person standing at the door, and the rest were just lined up in the main street. So it's easily done. It's not our human nature to stand so far apart, so it's easily done. But just reminding people, actually, could you stand over on the dot, blah blah blah. They understand. The first week it was maybe difficult because people didn't really understand why, or they weren't used to it yet. But now people are used to it. They're more than happy to stand because they know it's for not just the other person's safety but their own safety.
Absolutely. I'm just talking to Gemma Howell here about her role in one of the local pharmacies. We've seen some comments coming in now. Marie McBride, who's watching, has just said that it can be problematic for some people who have mental health issues, I think, to understand why someone's wearing PPE and that sort of stuff. And I know Marie has a background in that.
Yep.
So I guess part of your role has been reassurance and trying to work with people, because you'll see a lot of different people in your pharmacy, I would think, on a daily basis.
Yep.
And I guess it's just about you guys being well trained and probably talking about that, yeah?
Yeah, definitely. So part of working in our pharmacy is we all have even a small knowledge of mental health training. So to us it's just really important that everyone feels safe and welcome in our pharmacy. So we are very mindful that people in these situations that have mental health issues, that they know that like it's all right, like we're doing this for everyone,
and it's a safe place, essentially.
Yeah,
and I think that's been so important across the board, because I think people who have pre-existing conditions, but I think for everyone mental health has been a challenge throughout this time as well.
Definitely.
And we were just talking there about the queues, the kind of queuing system. We're all getting used to queuing for things. But someone actually painted dots, didn't they, outside your pharmacy and outside the local pharmacies? And if you live locally, and you probably see this, someone painted the 2 metre distance on the ground so that people could kind of stay far apart. So that was quite a nice touch, wasn't it?
We had a wee giggle when they first appeared, but it was so helpful. Like I was like, oh, I can't believe someone's done that, but I'm so glad that they did, because it gave people like the reassurance, like, oh, this is what I need to do. It was a wee reminder. It really did help.
Absolutely. So it's a very windy day in Neilston here. I don't know if you can hear the wind or see it in the background, but we're chatting to Gemma all about her role in a pharmacy. But I think we were just touching on that community spirit, I guess, because someone decided to go and just do that off their own back and kind of paint the lines. What have you seen happening in the community that's really kind of impressed and encouraged you during this time?
I think the community action people have been a great benefit. So during this situation with COVID, we're kind of asking elderly people not to come out as much because they're more vulnerable. It's more dangerous for them. So although we do deliver prescriptions, we have like a certain number, and then we can't deliver anymore because our driver, there's only so much you can do in a day. So the community action people coming forward and offering to deliver prescriptions for people has really been a lifeline, especially with elderly people, also vulnerable people, people that are displaying symptoms as well. Like, it's so important for them to not come out, so having someone deliver it to their doorstep and then them getting it, it's just
and have you found a lot, because there's a lot of community groups kind of setting up and have been set up across the communities, and you find that people are just kind of come in and saying, hi, I'm a volunteer, I've been given this kind of prescription to come and get, and has that just been quite common?
I wouldn't say it's common, but it doesn't take me by surprise anymore.
Sure.
So they'll normally have a list, some sort of ID on them, so we know that it's all right. But normally you kind of get to know like a few volunteers as well. You see their faces, so you know that they are volunteering.
I think, for me, that's been the big advantage, or the big positive that's come out of this, is that communities have kind of come together and wanted to help one another.
Yeah.
And I suppose my kind of question to you, as someone who is a student, who's young, who's going into this kind of field of immunology and microbiology, but also has a strong sense, I think, of your community and the job that you do, and also just through kind of what you do in your spare time. What do you feel needs to kind of change in our community? What do we need to learn from this going forward?
I think there's a lot to be learned from the first weeks when everyone was stockpiling. I don't really understand. I think I kind of touched on it earlier when I said people were scared, but I feel like it just amplified things, it amplified tension. I feel like maybe going forward we need to learn that, see, this is the thing, people were like stockpiling things, and then they were going on Facebook and saying, does anyone have pasta? And all these people were coming forward saying, oh, I have it, you can have this bag, you can have this bag.
Yeah.
Like, it was lovely that people were donating it,
yeah.
But at the same time, if they hadn't bought it, we wouldn't be in this situation.
Yeah. So I think perhaps we need to learn to maybe be a bit more relaxed about things, but also maybe to just connect with people a bit more and kind of look in and say, actually, what do we need? Have we all got enough? And can we kind of share that out a wee bit?
Yeah, definitely. I think it was nice that, like, when someone was actually saying, guys, I do actually need this, everyone was coming forward, so it's not so bad.
No, absolutely. And what do you think about that community spirit? You know, is that something we need to try and keep going forward? Because it maybe wasn't there to some extent beforehand, but now you've got people getting prescriptions for their neighbours, maybe being a wee bit nicer to pharmacy staff, I hope, you know, stuff like that. What do you think?
I think we should definitely keep it. I think maybe, although this situation's been really hard, that is one of the positives to come out of it. We've all got a wee bit closer, social distancing, obviously.
Indeed.
But I think that overall we should kind of keep the connections that we've made during this time, because it kind of shows you that when things get a wee bit tough, we are actually there for each other.
And just maybe finally, what about the science, Gemma? Because obviously you are a student of science. What do we need to learn from the science? Is it about, is testing been fast enough? Do we need to do more testing? What about the vaccine? You know, how are we going to find that? Is that the answer? You know,
a vaccine is the answer, I would say. You can't really put a timeline on things like this because there's so many moving parts. There's a lot of research going into it just now, a lot of money going into it, so hopefully, I mean, they're finding new things every day. They have a clinical trial for an antiviral that they were using for Ebola, which shows kind of promising results. That slows down, it speeds up your recovery time, so I think that's good. But overall, I don't think we took it seriously enough at the start, because we'd never seen anything like it before, so no one could have expected this situation. But I think going forward, we know what these situations look like now, so maybe when an outbreak first happens, even though it's not in our country, we need to prepare and we need to take it seriously.
So do you think more of a global approach then to how we kind of cooperate, I guess, on these issues? And you know, for me, it's concerning when you see like the USA deciding to step away from some of that stuff. So I think it's about finding the ways to push people forward so that we come together. I think investment has to be there as well, because I think maybe we haven't been as prepared for pandemics or stuff like that as well. Would you agree with that?
I would definitely agree, yeah. Again, we've never seen anything like this before, but now that we have, I think this is our chance to get prepared if we're going to see anything like this again, just so that it doesn't happen again.
Fantastic. So you've been watching Paul's Garden Gab. As you know, I've decided to do this in the garden, socially distanced as the rules permit, as we come out of lockdown and move towards recovery. Today I've been talking to Gemma Hibble. Gemma is an immunology student, but also works in a local pharmacy and has been working there throughout the kind of lockdown period. And you've been sharing some really interesting perspectives. So my two big takeaways today are that we need to invest more, I think, in our pandemic response and in trying to come together to research as a world community and try and stop some of these things before they maybe happen. But also, my other takeaway is that our pharmacy staff are doing an amazing job on the front line and have been doing that throughout, along with all of our other key workers in health and social care and all the other sectors. But please be nice to your pharmacy staff, regardless of whether there's a pandemic or not, because it's people like Gemma who are doing their very best to help dispense and to support people. And I hope that this weather stays. It's very windy here in Nielsen, as I keep saying, so hopefully the wind will die down and it'll be a nice weekend for you to get out and about in the garden and keep to the rules, look after one another. And please join me again next week when I'm going to be having a couple of garden gabs with some very interesting people. Hopefully going to be talking to someone who's been looking after their children during lockdown and teaching them from home and what that experience has been like, but also hoping to be joined by a very special guest next Friday, which I will reveal during the week. So please keep an eye on my social media for updates on that. Thank you, Gemma, for coming along today. I really appreciate it. Thank you, everyone. Take care and see you next time.